So I'm just going to hand it over to you. And if you can introduce yourself.
That's all good. All right, so hopefully this works now, because I'm not always the best with technology. So I'm so excited to be here and present this research. My name is Ashley Hope, and I'm the research coordinator at the Yukon Status of Women Council. Asia spoke earlier, who's also from our organization, and I just wanted to contextualize a bit of what we do. So we are an NGO organization that has a mandate around gender justice, using the tools of research, education, and policy analysis. And we did this work in conjunction with Dr. Fiona MacPhail, who is a researcher at UNBC and has specific interests in women in the economy and labor economics. So one of the important things when we started off this work, sorry, I'm just going to take a deep breath, was situating what women means to us and how we approach this research. We did this very deliberately in conjunction with Mona Luxian, who is they are now the ED at Queer Yukon. And so we use the definition, we include all women, including trans women, as well as people of other marginalized genders who share a sense of identity or experience with women. And this was very important in situating the research, but also being in line with our mandate of intersectionality and inclusivity. I have to admit, I'm pregnant and I'm a little bit short of breath anyways, so I'm having a bit of trouble. Just so you know, I'm not that extremely nervous. So this research project came about because we were seeing things across Canada happening where women were being disproportionately impacted by the impact of the pandemic. So this research project specifically focused on themes of the She Session, which is when we see a disproportionate decrease in women's work in relationship to men's in a recession. Their care penalty, which I think some of the other presentations have referred to, which is the gendered penalty that women experience in relation to the disproportionate amount of care work that they have to do, which is unpaid, as well as the shadow pandemic. And this was an uptick in domestic violence and IPV, which we saw happening in the pandemic. Thank you. It's because I'm trying to read around. And so we approached this with 3 different questions. How the pandemic impacted Yukon women's livelihoods. So this was both market work as well as non-market work. How the pandemic impacted livelihoods and well-being beyond income. And so when we're thinking about well-being, we were thinking more holistically, physical health, emotional, mental, social health, ability to engage in cultural ceremonies or events, as well as, for us, the importance of GBV, and then what the impacts of the federal and territorial responses were on the livelihoods and well-being of the women that we were talking to. And those were things like CERB. At one point, we had a phone program that was released, and other things like that. So we approached this with a community-based approach, using mixed methods, which include an intersectional analysis of both quantitative and qualitative data. And so what we're presenting today is a very, very small snapshot of the data we have. We ended up with extensive data, which is really wonderful, but also really hard to and time-consuming to sort of weed through. We had both primary sources of data and secondary sources. So in terms of qualitative data sources, I did 51 interviews with women-identified Yukoners. We also did a survey that we created and dispersed and collected about 142 responses. And we were also in terms of secondary sources, we were able to access data from Statistics Canada, the Community Index of Wellbeing, and Yukon Bureau of Statistics. So I'm just going to walk you through a little bit in terms of first focusing on our qualitative data. I'll walk you through a little of the pathway we followed. So first was the interview question development. And in this project being community-based, as Asia mentioned with our other project, these were done in conjunction with community partners and were derived from our community. And that was sort of an iterative process and was, again, time-consuming. Then we went on to interview collection, and we did interviews from November 2022 up until March 2023, and we collected 51 interviews, as I mentioned, with over half of the participants identifying as Indigenous. after we collected those interviews, and we have over 60 hours of interview data, we transcribed that. We used a nifty tool called Trent AI to try and do that. What we learned, though, is that it's not always effective at capturing speech, a cadence that is slower. And so that was a very long process in transcription because the confirmation took much longer than we were expecting. Next, we did coding, which included both initial and focus coding to, really dig into what the people were telling us, learning exactly from what was happening to them on the ground, and this informed a thematic analysis. And so what we were able to do, which I think, we're probably preaching to the choir here, was being able to consider our quantitative data with this intersectionality that the qualitative data brought for us. So when we reflected on what to present today, it was hard because we have only 15 minutes, obviously. So it's a very small snapshot of what we were doing. And so we wanted to highlight with the lens of what we would want decision makers and policymakers to know. And that is why we needed to use mixed methods and have lived experience reflected in these types of studies. So quantitative data, as many researchers in the room know, only tell us part of the story. When we were doing interviews with people, we were finding out, such depth and nuance that just the numbers weren't showing us. And what the importance of this is making sure that policies have fulsome and nuanced evidence so that they're responsive. Because in crisis times, we want communities that are primed and resourced with policies that reflect more complex intersectional social locations of all Yukoners. So I think Asia mentioned capturing those people who are in the margins of the margins. And so I'm just going to speak now to some of the things that we learned from the interviews. And one of the biggest takeaways was that the pandemic just put stress on cracks that were already existing in the structures and the systems that we have. So it came in and basically was a little pressure cooker for these people. In terms of the SHE session, or we're thinking about paid work, we saw people who were losing their jobs. We spoke to people who, healthcare workers, who were working more, who were filling the gaps, who were rising to the occasion, who were pivoting to fill the roles in our community that were perhaps stressed by the pandemic. We also saw people who weren't working and then weren't able to find work because of what the pandemic was doing to the economy here and certain restrictions on various types of work. In terms of unpaid care work, we saw women doing a whole wide array of things. They were working from home. They were providing school. They were, being the gym teacher, trying to navigate having no access to internet, perhaps, in doing school for their children. And when we're thinking about unpaid work, we're also thinking about the unpaid work that people perhaps are doing when they don't have paid employment. So navigating the systems and structures so that they're able to be resourced. They're accessing numerous sources of services and supports so that they're able to make it through, to get by. In terms of the SHE session, we spoke to women whose relationship dynamics were stressed to the point of creating a domestic incident or incidents, or people who were already experiencing gender-based violence in their relationships, and this was just amplified or further made complex by the pandemic situation. But one of the most stark takeaways from the qualitative data we had was the difference in experience of Indigenous women versus non-Indigenous women in how they interfaced and experienced the pandemic. These women, in particular, were not only just experiencing the pandemic, but were intimately experiencing other crises in our communities, including the opioid crisis, the housing crisis, and now our cost of living crisis. And so these people were disproportionately impacted by the impact of the pandemic. So now I'm going to switch gears a little bit and focus on some of the quantitative data that we had, just to give you an idea of what that was telling us and some of those spaces that the qualitative data filled. So just wanted to also highlight that when I referenced before that we were able to access the Community Index of Wellbeing, we were actually able to work with Dr. Brian Small and his team and have them disaggregate this data with us, or for us. We worked with them in sort of an iterative process to identify our key interests: the she session, care penalty perspectives, shadow pandemic, well-being beyond income, and then the perceived quality and accessibility of healthcare and mental health care, and then have that disaggregated by gender. So just an important point is that I'm not done, right? Okay. An important point is that when I do reference this data, it's a binary concept, just based on the answers that they received in the data in the survey. So the first theme I want to sort of focus on was the she session. So again, this is the sort of disproportionate loss of paid work experienced by women in a recession. And what with this Statistics Canada data showed us in the Yukon was that women and men were actually losing work at similar rates. But what was interesting from this is that around mid-2021, we see men recovering from the pandemic, those rates increasing, while women's remained the same. And so one of the things, although we can't necessarily say this is for fact, but one of the things we saw around that time was still having things in place in schools, restrictions in place, but perhaps a social shift in what the expectations are in the workplace in terms of, missing work. We also saw people running out of the leave that they did have, expending all of those resources and, coming together at this confluence where we are perhaps not recovering from the pandemic as well as men were. This graph is from the survey that we conducted, and we were able to disaggregate our data by ethnicity category, which we then determined was Indigenous, racialized, and Caucasian. And so what we see from our data in our survey, which was, again, 142 respondents, was when we're looking at paid work prior to the pandemic versus during the pandemic, Indigenous women reported a disproportionately lower amount during the pandemic than Caucasian women did. And this showed up in our interviews in terms of the type of work they were doing. Many of the women we interviewed who were Indigenous were working in hospitality-based, service-based industries that were then shut down, providing supports in mines that might have been shut down, sort of contract-based type of work that was impacted in different ways than perhaps other people's work was. And then we have some data here from the Canadian Index of Wellbeing in looking at the change in work status during the pandemic. And so what we did see, which is reflected in that Stats Can data, was that there wasn't a significant difference, at least at that point in time, this was collected in 2020, between men and women in terms of the amount of change in work status. But what we do need to look at is sort of more in terms of in the female group, what was happening. So in our interviews, like I think I mentioned, we were seeing people working more than, oh my goodness, 2 minutes already? I was so worried I was gonna be like 5 minutes. Anyway, so we saw people working more than typically they would, filling in gaps, meeting the needs of their community, their work, helping out coworkers, things like that when there were specific health restrictions in different spaces. Then with the care penalty, this is just from our data, we're seeing that the Caucasian women provided, what it looks like significantly more amounts of unpaid care work. And what we learned in the interviews were that there were also other considerations that should be being made during the pandemic, particularly with some of our Indigenous respondents. They were having experiences where their children were perhaps in alternative care situations, where they went to live with other family members to be able to access internet, to be able to do school, and different things like that brings in terms of context. In these data from the Canadian Index of Wellbeing, we see women are obviously doing some more in terms of care for children. And then what we were able to add with our qualitative interviews was the extent of which that was happening, what that looked like, how difficult that was and how that intersected with their well-being, their paid work, and many other things that we were talking to them about. And sorry, finally, the shadow pandemic. And what we saw here, if you look at sort of the red and yellow lines, is that women who were identified as being Indigenous were experiencing a greater increase in gender-based violence during the pandemic. And this falls in line with what we know in the data, but without this disaggregation of the data, that experience is invisibilized. And then, with the qualitative data, we're able to see where that intersected in terms of housing precarity, and their well-being. So just wanting to bolster again, the point, the key take home that we were trying to drive here is that it's really, really important when we're trying to recover and build resilient communities to have different types of data reflecting lived experience so that we're doing so in a way that reflects a greater span of Yukoners' experiences. And then thank you to all these folks who were supportive in our project, including our funders.